Different disabilities, common goals, connecting the pieces of behavior. The goals of the brief training will be to develop a student-centered frame of reference, recognize the functional nature of problem behavior, establish a foundation to make problem behavior less common by helping students engage in more acceptable behavior. Before we look at completing or the role purpose of a functional behavior assessment, the most important component is to construct a frame of reference. The frame of reference is what we build around the behavior we're seeing. The frame of reference tells us how we interpret the experience that the person must be going through. Framing behavior. In the top left corner, we've got a young boy who appears to be in class, crying. He appears to be frustrated or overwhelmed by the work being presented to him. The girl behind him seems to be attentive to the assignment, ready to learn and listening. But something about this young boy's experience is different than the girl sitting behind him. The girl to our top right appears to be staring out the window, daydreaming. She does not appear to be focused or concerned about what is going on or what is being taught in the class. Her experience appears to be different than the young boy behind her. Two boys at the bottom of the screen are fighting, or even playing fighting on the playground. The frame we build around these pictures will determine how we respond and how we interpret what we see happening. In frame behavior, sometimes a picture does not connect with what we think should be occurring. We have the gentleman on the left who appears to be smiling, but yet the words coming out of his mouth says that he's angry. We have the young child to the right who appears to be standing still, possibly preparing for some type of competition. But the words on the child's chest says ADHD. Nothing about that picture gives us the idea that ADHD is a concern, but the words across the chest of the child. Nothing in the picture tells us that this man is angry, except for the words posted by his mouth that say I'm angry. Sometimes it's not enough to have a simple snapshot of behavior or a picture. So our frame of reference needs to be detailed, and the way we interpret what we see need to be specific. People are people, disabilities are not. We all have the same type of problems. We all need to find ways to cope. Everyone needs help some of the time. Sometimes we do things for other people. Sometimes they do things for us. Let's look at problems with coping and how this can lead to problem behavior. You go to the doctor's office because you're sick. You check in at the desk and now you have been waiting for 45 minutes. 45 minutes. So you're checking at the desk, you're sick, you need to be seen by the doctor. And you've been waiting 45 minutes and have not seen the doctor yet. What kind of problems can this pose? And looking at this exercise, we ask ourselves, what are some good things that we can do? Well, during this 45-minute period of time, we can wait patiently. We can read a book, complete a crossword puzzle, play on our phone, or engage yourself in some other activity that reduces our frustration or makes the time pass by a little quicker. What are some of the bad things we can do? You can throw your chair. You can curse, swear at the receptionist, tell her how long you've been waiting there, or tell him how long you've been waiting there and that you don't appreciate it. You're going to take that pen and throw it across the room, or take the pad that you signed in on and throw that across the room, because it doesn't mean anything since you've been waiting 45 minutes anyway. You're going to disturb and distract the people around you with your negative attitude and your anger. What skills do you need to do the good things? One particular skill would be preparation, or being able to anticipate what you're about to experience. For example, if you're prepared to go to the doctor's office and you're prepared to wait 45 minutes, you may have bought a book, or you may have bought some type of activity or game to entertain yourself for that period of time. Maybe this wasn't your first time to the doctor's office, so you knew what to expect. You knew that it may be 30 minutes before you're seen, so you told yourself, I'm going to take a book this time, so I'm able to let the time go by a little quicker and engage myself in something while I wait. But how we develop these coping skills is what differentiates us between a problem behavior and being able to cope with situations being presented to us. Now let's change this story a little bit. Say that you brought your 5-year-old nephew or your 6-year-old niece, grandchild, or son or daughter to the doctors. You stopped them from playing a video game and from playing with their friends outside to rush to a doctor appointment because you said we got to be there at 11 a.m. So they left their friends, they left their game, and out the house you went. And you get to the doctor's office at 10:45 for an 11 o'clock appointment. Now the child knows that you rushed. The child knows that you're 15 minutes early. The child knows that they had to stop playing with their friends or playing with the video game in order to get to this important doctor appointment. Now they've been waiting for 45 minutes and no doctor. Would you be surprised that child started maybe flipping out, crying, fussing, becoming irritated? Because in their mind, they anticipated that we had to get to this doctor's office at 11 o'clock. And that we may be walking out there of the doctor's office, maybe 11:15 or 11:30. But to be there at 11:45 and have not seen a doctor yet can be frustrating for a child. Especially someone who's unable or has not yet developed the coping skills to deal with a situation of that nature. So in learning coping skills, we may teach them that we may have to wait when we go to the doctor's office. You're going to take a book or a game to engage yourself. These are things they will learn as they begin to experience life in the world around them. The coping skills that become important as it relates to other aspects of their life. As we begin to look at a functional assessment, the key part with this is if we don't know why a person is having a problem, we are just as likely to make the problem worse as we are to make it better. Functional assessment is defined by a pattern of behavior that repeats. We define what the behavior is. There's a pattern of behavior that is repeating itself, that we're looking at, that we observe, and that we see. We ask the question, is the behavior an attempt to communicate something? Is the behavior a way to avoid or obtain something? Or is the behavior the result of a medical condition or other factors? We look at the functional behavior and try to understand why the behavior occurs. We look at three main factors. What are the antecedents? The precursor. What sets off the behavior? Then we look at the setting, the events, things that set the person up to do the behavior. What's going on around them? What's the setting? When did it happen? Then we look at what are the consequences, the outcome. What does the person get as a result? Sometimes the consequences can promote the behavior rather than extinguish the behavior. So we look at the antecedent, the setting, and the consequence. Behaviors may simply persist and continue on because the individual enjoys the sensory experience. It may satisfy a need or impulse. Or the behavior may occur and persist because the individual wants to escape or avoid a demand or things they don't like to do. Or because the individual gains attention from others. Or they obtain tangible items or opportunities, something they want.